Okay, thanks for joining us, everybody. Um, I'm Connie, a peer support mentor for Colorectal Cancer Canada. I am also affected by LARS. I've had stage 3 colorectal cancer, or I should say rectal cancer. Today's series was made possible by Colorectal Cancer Canada, and especially Hannah, who's the patient support specialist, and she is your direct contact. Today, again, is our second Q&A session, and Hannah and myself will be tag teaming some questions that we are posing to Dr. Megan Bernard. She is a cancer recovery focused naturopathic doctor. And today we hope that you will take away some, tips and ideas to help you manage LARS. And last but not least, we want to make sure that you feel supported, that you're not alone in this journey. Everybody's at different stages, and you can reach out to Hannah anytime. Just give her an email. Before we start, we had Dr. Jenny Moon here last Wednesday, and she gave us some insight into LARS. I know that when I had my lower anterior resection, I did not know that there was a name for the side effects. And these side effects are what's known as LARS. So things like urgency, clustering, constipation, diarrhea, being affected by the foods you eat, as well as having to plan every move on where the bathrooms are. So these are a few things that a lot of us probably have in common in regards to LARS. The link will be on the YouTube channel for CCC, and Dr. Moon mentions that is in the process of doing research on LARS to better support patients. They're doing a booklet, and they're also doing an app. I know that I'm part of the study on the app, and they're even going through research on the benefits of irrigation. So if you're interested in joining her study, just send Hannah a note and she can give you Dr. Jenny Moon's email. Last week, again, we mentioned Jill Haverstock was here, and that session will also be posted on the CCC YouTube. We anticipate this session probably going about an hour, maybe a bit longer, just based on the amount of questions that we received today. So now I would just like to do a bit of housekeeping. If you have any questions for Dr. Megan Bernard, please either put your hand up in the reaction section. You can do an electronic hand, or feel free to put the question in the chat. I also want to note that everybody is in a different phase of this LARS journey. So we all have different issues that or questions regarding our issues. So please remember that this is suggestions only. It's not considered actual medical advice tailored to you. If you want to discuss personal options, please contact Dr. Bernard through her clinic. You can reach out. We will put her information in the chat. She also has a really good Facebook page and quite a few different seminars that she runs. So please reach out. She is a wealth of knowledge. And without further ado, I will introduce you to Dr. Megan Bernard. Thank you for joining us.
Thank you for having me here. Sounds like you've got some good information coming at you.
Yes, definitely. So why don't we start with just a few questions that I've posed to you. Is there questions in the chat? I'm seeing the chat going already. Okay, so those are a lot of info, which is good. So let's start with one that I was really interested in, because the first thing doctors usually pose to you to do, and they push it at you, is Imodium. And I know for a fact that I was told I can take more than the suggested amount. And I relied on that at first, but there are consequences for me anyway, in my experience, when I take Imodium. It's great if I have something specific, I definitely cannot afford to have any issues, but I know that I do pay for it for several days after. So just curious on how healthy taking something like that is on a daily basis. And for some of us, it could be technically, something we have in our toolkit for the rest of our lives.
Mhm.
I don't know. So any suggestions around that?
Mhm. It's tough because you're trying to balance like the quality of your life and trying to maintain your social interactions, going about your day with your overall health, and how you're always not quite sure about how things are impacting you. So Imodium in particular, like I know my mom didn't have LARS, but she had major digestive issues growing up, and she was like always on Imodium. She always was watching it for the bathroom too. And yeah, you kind of have to do that sometimes if you want to make it to like your kid's graduation or what have you. But whenever we look at the potential negative impacts of Imodium, and so that you can then balance that out with what you want to, when you want to take it, Imodium seems relatively safe at the like prescribed doses. There's no major nutrient deficiencies that are known from taking Imodium. In fact, you might have more nutrient deficiencies if you don't take it, because if you have a lot of diarrhea, then you're not going to be able to absorb a lot of nutrients. But whenever you take Imodium, it doesn't appear to decrease any like vitamins or minerals or anything like that. So that's one thing that's okay.
Mhm.
The other thing with Imodium is there's no real great research on long-term use with it. That doesn't mean that it's a bad thing. It's just that it's funny that no one's ever studied the use of Imodium over several years, which is super strange. You think someone would do that because it is something that's often prescribed in a doctor's visit, and then you just take it until you like actually just take it.
Yeah.
um, Whenever like there's no, I guess I could say there's no like reports of dependency on it with regards to like the intestines requiring it to stop diarrhea.
Right.
One of the impacts is that it's an opioid. So if you do take too much, it could have an opioid effect, and it can lead to addiction. So like if you ever Google Imodium and then overdose or anything like that, or addiction or whatever, it could be a substance abuse, used in substance abuse for people with opioid addiction. So that's one thing.
Interesting.
Yeah,
Mm.
yeah.
Wow.
But honest to goodness, like it's hard to say if it's like really bad for you, just
Yeah.
based on like the mechanism of action, it being an opioid, perhaps. But
Yeah.
again, that's only in like high doses. And I know you mentioned your doctor said in higher doses than normal, but I think you have to take it in like really high doses in order
Right.
to get that impact. So you probably still be safe.
Yeah.
And yeah, the major side effects are like super high doses would be like lowered respiratory rate, lower heart rate, that kind of stuff as an opioid. But yeah, it is tough to say, like, will you have any long-term negative impacts from it? It hasn't been studied. Just looking at the mechanism of action doesn't really appear to be anything that might be potentially harmful. And for the most part, I do see a lot of benefits to taking it. So I know it's kind of weird
Yeah.
from a naturopathic doctor hearing that medication
No,
is
it's
good
good to
sometimes.
know because
Yeah.
it's just one of those things you're like, as you're taking it, you go, should I be? Right.
Mhm, mhm.
Um, One thing I also wanted to, yeah, Hannah, I'm going to totally get to that. Um, One thing I do want to also ask on that note is because there is also some other drugs that are prescribed, right, when Imodium doesn't work for you that you take. And like you said, it is something that you just have to do, right? It's a quality of life thing. So is there anything that we can take that helps? Because I know like it's almost, I don't know if this relates to say is it Lomotil or Lomotil, something along those lines people take. I know Julie's nodding her head. She knows exactly what I'm talking about. Yeah. So does that do something to our stomach flora or anything like that? Is there long term that we should be supplementing with, or
Mhm,
because we need it, right?
mhm.
It goes back to that again, just like the Imodium.
Yeah, the Lomodal, or
Thank
however
you.
you say it, yeah, is, I believe it is an opioid, and but it has like an added part to it, like atropine, that is like an anticholinergic, which tries to combat the potential addicting effects of the opioid. So that's like the slight difference between the Lomodal and the Imodium,
Okay.
is it just has an added thing to potentially prevent dependency on it from an opioid overdose perspective or dependency
Oh,
perspective. Um, It could, so it could potentially impact gut microflora, but so could having diarrhea all the time. So it's less about the medication as opposed to like what's going on in the bowels that would have the impact on the gut microflora. So I wouldn't say that necessarily the medication is going in and like killing or encouraging the growth of certain bacteria. It's more the lack of movement versus the movement of not taking it that might be having an impact on bacteria. Does that make sense?
Yeah, absolutely. So in regards to that, then, yes, thank you, Kim. She also mentioned, Kim's asking about the probiotics, then something like Align, or if there's
Mm-hmm.
other probiotics. And I would add to that, on how much does someone take?
Mm-hmm. Probiotics can be tricky because I've had people who will take them and then they feel worse. Some people take them and they're like way better instantly, kind of thing. You kind of have to play around with probiotics sometimes. Same with everything that you guys are probably figuring out when it comes to food and certain supplements and stuff like that. You got to figure out what's working for your body. Probiotics are meant to kind of restore some healthy gut bacteria. We all have microflora and there's a good balance in there. Sometimes you can have too many good bacteria, and too much of a good thing can be a bad thing as well, causing gas, bloating, diarrhea, constipation. Sometimes you can have some stuff in there that shouldn't be there, like bacteria that's not naturally in our gut, and that could lead to gas, bloating, diarrhea, constipation, that kind of stuff. So whenever you're looking at a probiotic, that's why some probiotics might work, is because perhaps it's helping to restore bacteria, like good bacteria that might not be there. It's potentially trying to crowd out any bad bacteria that might be there. But at the same time, if someone takes it and it makes them feel worse, it could be that they have too much bacteria in their gut already. Then you're adding on top of that, and then that's making them feel worse. So that's why you can kind of get the two different impacts there whenever people take probiotics. A thing you want to consider when taking probiotics is you want to have a multiple types of bacteria within that pill. You want a bunch of lactobacillus, you want a bunch of bifidobacteria, and there should be like different strains under each. So they make maybe 3 or 4 lactotypes, 3 or 4 bifidotypes, because we don't just have one strain of bacteria in our gut. We have a whole bunch of different types in there. So if we're just overfeeding it with like lacto, for instance, then that's just really going to build up the lacto to a point of imbalance, and then that can give symptoms as well. So a probiotic like Align, I believe, I cannot remember, but it might be just lacto or just bifido, and let's say they've changed it in the last little bit. So I find the Align is not super beneficial for people unless they were already insufficient or deficient in that particular strain, and then they took it, and then that's what would make them feel better. Is this making sense so far, guys?
Yeah, I think my question on that would be, how would you get tested to know, or is there a test to know if which one you're short in or which one you might have too much of?
Yeah, we're getting like really fantastic test options out there right now. The only problem is it's like stupid expensive. Like a good stool test can be around like $500 sometimes. But it's like they're super thorough. They're fairly accurate because they're doing like PCR testing. So they can do they're doing like PCR COVID tests and stuff like that. So you can really get into the details of how much bacteria, how much viruses, it tests for parasites. That kind of stuff as well. Typically, I just see an imbalance in bacteria, or sometimes like I'll see H. pylori pop up or C. difficile on some of these stool tests. But yeah, the one that I don't know if are we allowed to like say brands or anything like that?
Yeah, I was going to ask you if there's one in particular that.
Yeah. The one I most often use, and I find like my colleagues use too, is called the GI map test. And you can even like go on their website. It's Diagnostic Solutions, GI map. And I think GI map is like the test, and then a bunch of different companies offer it. And then you can see like sample reports, and you can see everything that's tested. And it's really quite cool. They can even, and it's less scientifically validated, but they can test like the structure and the integrity of the gut lining. You can test like, are your gut cells nice and tight, or are they a little bit loose, kind of thing. Again, it still needs more research behind it to be more conventionally accepted, but it's kind of cool to see some results whenever we treat based on those results. What else can I say about that? So it can test like, is your pancreas working appropriately to break things down? You can also test that on blood work. What else is a test? Like inflammation in the bowels, basically. It can test for like gluten sensitivity, not necessarily celiac, but are you maybe a little bit more sensitive to gluten? It might be something you want to try cutting out for a little bit. Yeah, it's a pretty cool test. So GI map, Diagnostic Solutions is where I really check it out. It's where I usually get it from. And yeah, it just goes through bacteria, viruses, parasites. And then that can tell you like how much bacteria, what kinds, and then you can kind of take an idea of what maybe probiotic might be beneficial for you. So it might come back saying you're a little bit low in bifido. Perhaps you can find a probiotic that just has bifido in it or has more bifido in it to help restore that balance.
Thank you. So if I'm understanding this, at the very beginning before the mapping stuff, would a probiotic potentially then, if we're only taking maybe one kind or we're not taking the right kind, could cause more gas?
Absolutely.
Yeah. Okay.
Yep.
So in regards to that too, in say you have a great probiotic that, you know, it's about regular taking it, correct? Like our systems, I imagine they would get used to the probiotic and then eventually the gas would go. Okay.
Yeah. So the best way to kind of approach taking a probiotic is like, once you find one that you think is working for you, you should probably take it for a little bit of time. I mean, if you start taking it and you find that immediately your symptoms get worse, then it's probably not necessary to continue it. Maybe give it 2 days kind of thing. But if you find you're taking it, maybe you don't notice a difference yet, or you're feeling a little bit better, you're going to take it for probably a couple months. And then once you stop taking a probiotic, because it's like not the natural environment of your digestive system to kind of encourage that kind of growth in the first place, perhaps there's just something else going on with the foods you eat, the environment you live in, what your past exposure was to these bacteria and the way that you built up your gut microflora in the first place. Once you stop taking the probiotic, your gut microflora is going to change on its own over time as well. It might go back to its natural state. So maybe after a couple of months, you notice that your symptoms start to come back, then you probably would have to go back on the probiotic to get back into that relief. So that's like kind of like crappy part about doing these probiotics is sometimes you have to take them for life. You have to like cycle on and off of them because you might not see the same results for ever going forward whenever you come off of them.
Mm-hmm. This may be a really silly question, but I'm just going to go for it. Can a probiotic make you go more?
Yeah. Because like what happens, like well, in certain situations, why do you have diarrhea? Because your body's trying to rid yourself of stuff that it doesn't want or doesn't need. So if you have too much bacteria in your intestines, you're going to have diarrhea to get rid of that bacteria. So that would be a big reason why like a probiotic might lead to having diarrhea.
Okay. So when I hear that, I go, wow, I know I probably should take a probiotic, but I also know that I have that other issue. So I think I would deal with the other issue first, right? Like it's one of those things. I know everybody's individual. Okay. So on the note in regards to what to take, I'm curious if there's specific things that we should be taking to either help with diarrhea or help with constipation that are maybe more natural than I was told recently, because I had suggested to my mother-in-law to look at psyllium fiber. And her doctor actually said, oh, don't do that. You're just going to bung yourself up even more. And so it was kind of like, wow, that's conflicting from what all my reading was and the stuff that I had researched that helps me from other hospitals where I got a lot of my research from. So I don't know if you can comment on that.
It really is tough because it is so individualized. So I think the best thing is to try things out on a time when you don't have anywhere to go and see what happens. And I have a feeling it's really hard to kind of pick apart what's evidence versus what's opinion versus what's someone's clinical experience. Like that might have been that doctor's clinical experience where he tended to see more people try it out and then have more issues. So that's stuck in his brain. Whereas it might be on the websites as in these research papers, it shows this. And those research papers might not be applicable to the human being sometimes, like the general person, or vice versa. Like maybe that is more of what a typical population would see. So it's really hard to pick that apart. My best advice is just to kind of figure out, do you have a couple days where you can try out some things and see what happens? But I can kind of talk about like some things to address when it comes to diarrhea in general, like maybe not, you guys all have different symptoms and things like that too, but, and you might have to figure out what works for you, but just whenever I look at someone with diarrhea, we can kind of go through what kind of goes through my head. Would that help?
Yes.
Okay. And then we'll do constipation too. So diarrhea could be like, in like a general kind of case of diarrhea, could be, we want to look at the microflora. We want to look at the integrity of the gut lining. We want to look at, what else? We want to look at like the nervous system input. And we want to look at the immune health in the digestive tract as well, because there's something called the GALT, the gut-associated lymphatic tissue, which is a big part of our immune system. If we've got overreaction of the immune system in the digestive system, that's going to cause problems as well. So we already talked a little bit about the microflora. So you can have too much or too little of good bacteria. You can have some bad bacteria hanging out in there. So you can kind of experiment with certain probiotics. We can also use certain herbal antimicrobials. You can do testing, and you can take antibiotics to try to target specific bacteria to kind of find that balance for whatever's needed. So that's one way, because again, if you have too many bacteria or some bad bacteria in there, that might, one of the side effects of having that particular type of bacteria could cause diarrhea. You get diarrhea. So you got the microflora, the integrity of the gut lining. So like, is that gut lining nice and calm, or is it like super inflamed because you just had surgery? Perhaps you ate some foods that really irritate the gut lining. Perhaps we talk about food sensitivity sometimes in naturopathic medicine. And that can cause some irritation of the gut lining, which means that like everything's so irritated, just want to push everything out. And that would lead to diarrhea as well. So we can talk about addressing the integrity of the gut lining by protecting it. So certain herbs like slippery elm, DGL, which is deglycerinated licorice, and like aloe, like those things, they can kind of protect the gut lining. Again, too much can sometimes lead to diarrhea. Like aloe can sometimes cause diarrhea, so just be careful with that one. But basically it just kind of coats the intestinal lining, kind of protects it from everything that's going through the intestine, so that it can take some time to like chill out and heal and not be so inflamed anymore. For gut lining, we also want to look at making sure that we're getting enough nutrients to the gut lining as well. So eating a good balanced diet as best as you can. You don't have to do this, but this is one option where you can do IV therapy, where we do like Myers cocktails or nutrient IVs as well. So that way it bypasses the digestive system and gets absorbed directly into the bloodstream, so the nutrients can be delivered. So we can do B vitamins, magnesium, calcium, vitamin C, like those kind of things, just to kind of give your body a boost if it's not able to absorb a lot of those things. And then what else have we got here? Then there's the immune system. So we got to calm overall body inflammation, because if one part of the immune system is off, like whether it's gut or the rest, like it's all super connected. You can't really have one part off and not the other. So if you're inflamed, if you have like joint pain, other signs of inflammation going on in the body, by just addressing that might help restore proper immune function as well into the gut. And like things like colostrum are pretty good for gut function with your immune response. And like I said, just overall addressing inflammation, and good things for inflammation would be like curcumin, boswellia. Those are really good, nice herbs for that. You just got to be careful of medication interactions, especially with curcumin. It loves interacting with other medications. Okay, I just talked a lot. Is that okay? Is that good?
No, that was
absolutely.
fantastic. And the fact that you say that even curcumin, that's turmeric, right?
Yeah. Mm-hmm.
So the one thing you do learn from going through these cancer diets, are even my, I don't know if she's a nutritionist or dietitian, I apologize, but I had worked with one through the cancer center, and yeah, it was things like turmeric are really good for you, but I wouldn't have a clue if it interacted with anything I'm taking, my regular medications. So that's really good to know. And I should even I imagine a pharmacist would probably know the difference too, right?
Yeah, I find like I love pharmacists. You gotta find the right one though, because often they will just they want to play on the safe side, and they'll try to avoid natural things. Like I totally get it. There's so much going on in the human being. Okay. There's so much going on with medications and stuff. So you'll often just say, just don't take it, or that's what you'll hear. I would highly recommend talking to like a naturopathic doctor. We are very much trained in that kind of stuff. And it's not simple, like natural is not always safe. So we do have to be careful, especially like curcumin, turmeric. In food, it's really fine. So if you want to cook with turmeric, go for it. Yeah. But like in a pill form, it's very concentrated. It can interfere with a lot of medications.
Okay, thanks, Megan. That's really,
Mm.
that is really good
I think
advice.
pharmacists are great. I just want to put that out there, but just
No. I get
yeah.
that. I wasn't. But you know, when you get your medication, you expect you get interactions, but you don't actually. You don't get it with herbal stuff. Yeah.
I just want to make a distinction. You were mentioning if you cook with it, it's okay. So does that mean that, it changes the properties when you cook with these spices or these herbs or whatever, and then it doesn't interact as much, or?
It's like the dose.
Okay.
It's the dose difference. So like whenever you're eating with it, you're getting like the whole root or like the whole spice. Whereas like if you take curcumin or turmeric in a capsule form, it's like a lot in that little pill. It's usually like, it's not just the spice. They've extracted certain components of the spice and then concentrated that and then put it in a pill. So then it's those like concentrated portions that whenever you have, that's really going to heavily affect like your they're called like your P450 and your P450 enzymes. They happen in the liver. They help to break down certain medications. So like your curcumin and your medication might be fighting for breakdown in the liver kind of thing.
Okay, so we're talking about it more in like pill form rather than just using it to cook with or whatever. Okay, good to know. Thank you.
Maybe if you're eating it like 3 times a day, every single day, maybe that might have a bit of an impact. But it's different than like how grapefruit would interact with a lot of medications. Curcumin or turmeric root would be slightly different than how grapefruit's pretty impactful. They say to avoid grapefruit juice, but you could have some turmeric in your food.
Okay, thank you.
Okay. Yeah, thank you. So I believe, and correct me if I'm wrong, we talked about diarrhea.
Yeah. Do you want constipation?
Yeah, let's try
Go
that.
to the other end of the spectrum here.
Because one thing that I do rely on and is magnesium. And if I take just it at the wrong time, it does do the opposite effect to me. I can even just drink something as small as coconut water and I'm affected. So where some people need to take a lot more. So yeah, if you can address other options or that option even, then maybe I'm taking it wrong.
Yeah. So the whole like background of everything, and just bringing up my notes to see if I forgot anything that I wanted to talk about too. But the whole thing, like the 4 components that I mentioned are like the same with digestion, like no matter whether it's diarrhea or constipation. So again, like I forgot to touch on the nervous system. We can touch about that with constipation, but the microflora, the gut lining, the immune system, and the nervous system input, like those have to be balanced whether it's diarrhea or constipation. So same things apply. Check your microflora. If you have too much, too little, whatever, that can still cause constipation. Just depends on what bacteria are hanging out there causing the issue. Immune system and inflammation being off, like that's just going to irritate your gut lining. That's going to cause an imbalance with inflammatory processes in the body. Again, it could either cause diarrhea or constipation, just depends on your constitution in a way. And then the nervous system as well. So like we've got this giant nerve between our brain and our digestive system, the vagus nerve, super important for sending signals from our brain to our gut and vice versa, from our gut to our brain. So a lot of times if we're stressed, you might notice that you get backed up, or like the general person might get backed up. That causes constipation because that signal is being slowed down. The focus is being put on fighting or like fleeing a situation sometimes whenever we're stressed, as opposed to resting and digesting our nervous system. So those juices stop being secreted, like the hydrochloric acid and the digestive enzymes. The peristalsis of the colon or the intestine stop moving as nice, and then things just stop in a way, and that can lead to constipation. So I find an abdominal massage, you can just YouTube abdominal massage to be very beneficial. It helps to get the movement through the intestines. I find digestive bitters are really good. So digestive bitters can stimulate that vagus nerve. They're like herbs. So, like martinis, I guess. Would martini have bitters in it that you would sometimes put in? I don't know. I don't really do martinis, but you might have heard digestive bitters for alcoholic drinks, but they're literally just herbs that you can buy. And that's all like a digestive bitter is for the most part. You can get herbs at the herbal store or your health food store or whatever. I typically look at the St. Francis ones. I find they have a good combination. And it's a really disgusting tasting tincture, but it's totally worth it and you get used to the taste over time. So I usually get people to do like a full dropper. Again, this is not medical advice, so be careful. I think they only say like a few drops on the bottle, but I do like a full dropper in like a shot glass, top that up with water, give them a pinch of nose, and then like chug that back. And that gross taste stimulates, it's like very bitter. It stimulates saliva, it stimulates the stomach acid, it stimulates the pancreatic enzymes, it stimulates the peristalsis of the intestines. So, and it does that through that vagus nerve kind of triggering in a way. So that helps to move things through the body. Again, I find probiotics very beneficial with constipation. Acupuncture is also pretty great as well, like traditional Chinese medicine acupuncture. And that can stimulate the vagus nerve. That can also work on certain points to help stimulate like certain parts of Chinese medicine that help with bowel function. Those are like my big keys, like probiotics, digest bitters, and like abdominal massage. And like, I do find dairy really does back people up. So if you can really eliminate dairy for a bit, that would really help. Yeah, I think that's like my big things with constipation.
Yeah, thank you. I'm assuming that bitters, digestive bitters, are different than digestive enzymes, correct?
Yeah. Yeah.
Okay.
Yeah. The bitters are the herbs. So they're like plants. And then the enzymes are enzymes, like they kind of mimic or actually could be like extracted from animals or something like that. The enzymes that our pancreas makes to start to break down like proteins, carbs, fats, that kind of stuff. So the like little scissors that we're eating that are going in and cutting down the food. That's what an enzyme would be.
Okay. Yeah, thank you for clarifying the difference. So would you say then, just on that difference, could we be low if we're clustering? Do you know what clustering is?
I feel like it's been so long since I've had a LARS patient.
It's okay. It's okay. Let me just mention it because so clustering is like when you go and then you basically, you get up to leave the washroom and 5 minutes later you go again. And then 5 minutes later, your bowels are acting again, but you can go a lot in like 1 hour. Mm-hmm. Basically, that's clustering. Mm-hmm. So it's a bit different than both. It's not diarrhea and it's not constipation. It's kind of the middle ground, unfortunately. So I'm curious if that is where an enzyme would be more helpful, because it's crunching the food all more at once instead of at little bits at a time and releasing, or you know what I mean?
Yep.
What are your
hard
thoughts?
I feel like there might be different mechanisms of action behind why that might happen. Like obviously it's like an innervation thing. It's the side, like the like what's left of the intestines, that kind of stuff, or rectum.
Mm-hmm. Yeah, so that's just it. Like most people have most of their rectum gone, if not all of it.
Yeah.
At this stage of the game. So yeah, there's also that of it needs time to learn how to be a colon. Or the colon the other way around, needs time to learn how to be a rectum.
Yeah.
But at the same time, I didn't prompt, my apologies. It's how do we get through the at least the not clustering part of it, right? Because that's the planning of, always having to use the washroom potentially, is you think you're safe and then you're not.
Yeah. I would probably look at everything still that we chatted about, just finding an overall balance in the digestive system, in the body. That's going to lead to more consistency. I think overall, you get a better understanding of what's going on with your body, you get to know your body better that way as well. And then have you guys ever had like a pelvic floor physio chat with you guys?
So that's what we're trying to get.
Yeah.
Yeah, we're working on that session as well.
Okay, cool.
What do you have to say about that? That would be interesting to hear.
Pretty much all my intestinal surgery patients get referred out to a pelvic floor physio that I work with, because I think it's super important for them to get like a mechanical and a physical feel of what's going on and an understanding of the body that way too. Their exercises are super helpful because everything's changed. Like your muscles have changed. The intestines have changed. Like all those need to be kind of retrained. Like you said, they need to learn how to function differently. So that's usually like my first go-to for like something like clustering. Yeah, deep breathing. Yeah, I still didn't really talk about I'm seeing a note here about the nervous system. Yeah, deep breathing, relaxation, all those kind of things. And I would like just a good balance, pelvic floor physio, Maybe an abdominal massage would help to push things through more regularly too, but you got to be careful that that's not going to push a diarrhea episode as well. And just that would help to like put everything more compacted, perhaps, if you did the abdominal massage.
That
But
could
yeah,
also,
that is
I
tough.
wonder how, if if it gets complicated when someone has like an ostomy, in addition to all that as well.
Like
Yes,
figuring out
that's
where to do the massage.
exactly.
Yeah.
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 So probably that has to be discussed with the doctor prior to trying it. I want to, if you don't mind, Megan, I just want to go back, Julie, and sorry to call you out, but Julie is a nurse here in Montreal. And so I think this was from before when we were talking about the diarrhea, the other side of the coin here. But she mentioned at my hospital, we recommend drinking at least 1 liter of water per day if you use psyllium to help bulk up the stool and not constipate. So I'm wondering what your thoughts are on that.
Oh, me, that like absolutely. I think that's where the doctor that we were speaking about before probably saw negative impacts from it, is like psyllium's like super, like you gotta have that water to push things through. So definitely go for the water to get any type of fiber through the system a little bit more effectively.
Yeah, and I was actually told that I needed to take a minimum of 2 liters per day of water. So I have mine planned out every morning with my name on it. Again, I'm terrible in my home. No one touches that water, just like my unbuns. And just to make sure that I get enough, so and that doesn't include necessarily tea or that kind of stuff, just because I do need to take the psyllium. But thank you. That is a super important component, is getting enough water. Definitely.
With or without fiber, like about 2 liters of water a day is a good habit formation. Yeah, habit thing.
Does anybody else have any questions before I keep going on? No, just put them in the chat. Honestly, it's great. Thank you. One thing that I do find tough is eating enough fruits and veggies. I have a love-hate relationship. I try often. And different ones. Sometimes it's good, and then I think I'm safe. And I've learned from Jill that just because you eat it once doesn't mean you should be eating it 3 or 4 times, because then you're going to have potentially a negative effect. But I still don't feel like I get enough. I am taking a greens, but I do find the days I take my greens, I'm actually in the washroom more. So I'm wondering if it's that I'm either taking too much, or is the greens really good to take? And is there different brands? I mean, I know you probably, you can't be privy to any one specific brand, but just a heads up on how do we get enough fruits and veggies and know that, the supplements we're taking maybe are making a difference or not.
Mm-hmm. It's just like, I'm really glad that you guys are already pretty self-aware, because it really does come down to what your experience is, and documenting that. With the greens, maybe you want to look for something like a different brand that's a little bit more simple, so there's not as many ingredients in it, because perhaps there's something in there that might just be overwhelming your system. So like simple is always better to start, and then you can kind of expand from there. It might not be that you're taking too much. Like, I don't feel like that's a typical side effect from a greens powder that would be like documented on the side of the bottle, unless you like took the whole bottle. But I think it's just there might be something in there that's just causing some sort of inflammatory trigger or overstimulation of the bowel or something like that that's pushing things through. And it's tough to get your veggies. So is it more that like it's hard to eat them because you don't like them, it's hard to eat them because you don't want to cook them, or is it just literally the bowel issues that are arising that are the biggest difficulty?
Yeah, I think the majority is there are the certain ones that do cause gas, right? Anything that's broccoli, cabbage, any cauliflower. So those are, good ones. And the same with having the too much fiber. So now you're limiting even more. Yes, I peel the skins and but the skins have have the nutrients. Mm-hmm. So I feel like then sometimes I'm just eating to get full, but how much nutrients are actually am I getting? So I guess that's where supplements come in. I guess that's where your IV booster comes in. Right.
Yeah.
At the same time, are there certain supplements that we should make sure we have every day? Like, I know I'm terrible. I have my big thing of omega-3, and sometimes I take it and sometimes I don't. And you get sick of taking another pill. And, it's just, but there are probably certain ones that I should be taking.
Right.
Just seeing if there are, a cocktail that we should all have as staples, like D for sure. I was told from my surgeon, D, like make sure you take your D, and I take 5,000 just because they say cancer patients should take 5,000 to prevent it. But, if you have any other helpful ones, I would be more than open to listen.
Sounds great. Yeah, supplements are tough because like you don't want to take medications, you don't want to take pills basically, and the supplements is just kind of like another medication sometimes. And consistency is often key with supplements as well. So it's like tough to like, I got to take this for life. They can be expensive. So number one is to do what you can with food. Obviously, it doesn't always work out because things just don't always sit well in the stomach. So do what you can with your food. If you're just skipping out on peels, you're probably not missing out on too much of the nutrients in that food. So we can talk about like some key. So yeah, vitamin D, I think that's my number one favorite vitamin ever that I pretty much recommend for everybody to take. You can take it on and off. So like if you want to take it 3 times a week, you probably would be okay with that. If you want to take it for a couple of weeks and then don't take it for a couple of weeks, you probably would be okay with that as long as your levels are topped up. I love testing vitamin D on blood work. I think that's super, super important for anyone who has any type of cancer to get their vitamin D tested on blood work. I do that with like almost all of my clients. And I would say they all come back around 30 or 40, which is the bottom end of the normal range. Whereas I like to see it at 75 to 100, which technically is high in the conventional system. But I find there's a lot of good research going forward that those high doses are better for cancer patients. And also it's safe as long as you don't have major kidney or like parathyroid issues, then vitamin D is really a safe vitamin. One thing about vitamin D, you want it to be a liquid because it's a fat soluble. Vitamin A, D, E, and K, ADEC, are all fat soluble vitamins, and they require fat to be pulled into the cells where they can actually be used for processes in the body. You can also like have a tablet and eat it with food, but I find it's just better to just do the liquid. I have seen people who have been doing the tablets, even eating it with food, and then we test their blood work and it still hasn't budged or it's still in the low range. And then like this has happened time and time again where we put them on a liquid and it's like immediately starting to go on immediately, but it goes up after like a 3-month whenever we start to test again. So liquid does make a difference. That one's important because it gets them, like most vitamins get absorbed around the intestines. Did you have a question about that? About vitamin D? No. Okay.
That is great. But would you also suggest having a multivitamin? Someone had asked about multivitamins. I mean, I know post-surgery, there are different vitamins probably that we need more so than every day. Is that true? Or what do you
It
think?
very much depends, eh? Like it depends on what do you typically eat, like what kind of activity level, like do you burn through things? What kind of stage of healing are you at? Worst case scenario, pretty much you take a multivitamin and then there's no impact. You pee it out, that kind of stuff. There was like a study out recently, like actually a couple of years ago now, where like people with multivitamins tend to have a higher risk of mortality or something like that. Like that was the ending of the article.
And there was also something about if you're middle-aged, you shouldn't take middle-aged women or something. There was all these different things going around. I know I stopped taking my multivitamin and then I'm like, no, you know what? I just need it. So yeah,
I would take that with a grain of salt if you dig into it. Like one of my colleagues who is like, his brain is incredible. He did a really thorough look at that and picked it apart, like did a very thorough review of that research paper. And it wasn't to say like we are naturopaths. It wasn't to say, of course they're wrong. Like he did points for and against what they came out with. And there's just the whole the end of that paper where they say, in conclusion, it says this, like that was just taken out of perspective. So if you take a multivitamin, it's unlikely to cause you to die. So I wouldn't worry too much about that. Is it going to help? Maybe, maybe not. That's the issue. Probably more in a case where you are having gastrointestinal issues, it's probably going to do more good than harm. There are some concerns like selenium and lung cancer, for instance. So if you smoke, if you get lung cancer, you might want to be careful of those kind of things. But I think they're pretty safe. One thing you want to do is like, you want to get a really good quality, like professional multivitamin brand, I would say, like Centrum and things like that. They probably aren't really doing a whole lot of good. Again, like probably have to look at the research. A lot of research is done by the company that produces them. So it's really hard to kind of figure it out. But the way I look at it is, even though we don't have the research, we want to look at how the vitamins are used in the body. And we want to kind of look like for the active forms of the vitamins. So folate instead of folic acid, for instance. Folate is more readily used by most people more easily, whereas like the body has to take folic acid and then make it into folate. And sometimes we're missing key components in our body to convert that folic acid into folate. So we can't get the folate, which is like the good thing that we want. There's P5P, pyridoxal 5-phosphate, as opposed to like, oh my gosh, I think it's I always forget, it's B6 or B5, one of the two. Even though it says P5P, I feel like it's still not vitamin 5 or B5. It might be B5 or B6. So that's an active form, whereas like typically the form of vitamin B in, or any of the Bs in like a Centrum would have to be eaten, converted into the active form, and then used by your body. But you can get some good professional brands that have like the active form in it already. You eat it, and then it's easier for us to use those aspects. That would be one thing to consider. Again, like it's really hard. Like this is just super general advice. Maybe you need it, maybe you don't. The best kind of way to figure it out is to maybe check your blood work, check your vitamin B12, and that there be a B12 in the multivitamin. You can check like magnesium and stuff like that. It doesn't really give you a good review of it. But take the multivitamin, see how you feel is probably the best way to figure out if it's doing you any good. I could talk forever. So.
Listen to your body, and we can listen forever because you're phenomenal, Megan. Connie, if I see there's a question in the chat. The only veggies I can eat are very well cooked carrots, green beans, potatoes, and squash. I've tried all the others. They cause severe pain and clustering. I try to get lots of berries and smoothies. I also found green powder made me cluster. What nutrients am I missing from not eating all the other veggies?
Let me see. So did you say you could get greens?
Saying that it clusters, they cause severe clustering.
Okay. I would say more like this would be a way better question for Jill, but I can totally try this out. So like the B vitamins perhaps might be a little bit better in greens, especially like the folate would be better in like a green. But honest to goodness, like that's not bad. You're still getting a pretty good variety. Like, yeah, perhaps they might have more of the like carotenins or like the vitamin A's and stuff like that because they've got that orange or red color. But you're still getting other things, even if it's not like the vegetable with the most amount of that certain vitamin in it. There's going to be some of those vitamins in those vegetables as well. One thing I guess that might help with clustering as well, or just in general with taking some of the impact off your digestive system, is taking a digestive enzyme. You kind of have to figure out what digestive enzyme is going to work for you as well, because they're all a little bit different. It's kind of like a probiotic where they have some types of enzymes, but not other types of enzymes. I also look for one with bile typically, even if someone has a gallbladder. Gallbladder produces bile. If you don't have your gallbladder, you have less bile. Well, gallbladder, yeah. Gallbladder, if you don't have your gallbladder, you have less bile produced. The one I typically use is Digestzymes by Designs for Health. That's just what I've used and seen results with. It doesn't mean that it's the only one that you should try. Mm-hmm. And that might help with eating more different types of vegetables if you want to experiment, because maybe it'll break things down a little bit better for you. Or perhaps that might even help with clustering as well. And I usually get people to take that like 15 minutes before main meal. So if you don't really have a big breakfast, you probably don't need it, but like lunch and supper, get them to take that before the meal. Same with bitters. The timing of bitters is before a meal to start to stimulate the digestive juices. What else about the enzymes? You just want to look like for a variety of different names of enzymes in your digestive enzyme when you're looking for one.
So Megan, you were talking before about the probiotics and figuring out what works for you. And then there's this test that you can take to sort of determine that. Is it the same principle? Is there something similar to figure out which digestive enzymes might, you might need, as opposed to, one product versus the other?
No, not really.
Okay.
Yeah, I would say there's no thing that I know of that would be fantastic though, to be able to see. I think that would probably change a little bit on a regular basis as well,
Okay.
depending on what you're eating at each time, but not a whole lot. But yeah, nothing fancy like that.
Maybe this is, I don't know if this question even makes sense, but the difference between taking probiotics and then taking a digestive enzyme. So like what are the differences to the system, sort of different functions type of thing?
Yep. So the probiotics got like the bacteria in it. So it's going to restore the microflora, and the microflora does play a part in breaking down food as well. Like it will be a part of eating your food particles and breaking them down even smaller. The digestive enzymes are like the scissors that'll go in and break up like the proteins and the carbs and fat as well, just like different kind of similar end products, but different things going out and taking action.
Okay, thank you.
Megan, I wanted to bring up something that came up when I was researching diets, is SIBO.
Mm-hmm.
Can you tell me, someone said, well, go get tested for SIBO, and maybe that's the problem. But does SIBO, is that based on the gluten in your body? Like, I'm super confused. So if you can kind of give me an idea of what that's about.
Totally. Yeah. SIBO is like super complicated, but really cool at the same time. It's becoming more and more research, which is nice. Still, obviously, like anything, it's new. It's not really well researched enough just yet. But SIBO, small intestinal bacterial overgrowth. Typically, your small intestines have like very minimal bacteria hanging out, whereas like your large intestines would tend to have the bacteria that we would typically talk about with a microflora. Sometimes what happens is we think there's like either there's a backlog or things start to overgrow in the small intestines, and we get bacteria where they shouldn't be in higher numbers. And that's why it's called small intestinal bacterial overgrowth. What happens is people can get diarrhea or constipation or both. They can get a lot of gas, bloating, burping, heartburn. Those are typical symptoms that we would see pop up. They have really hard time digesting carbohydrates. They get tested for everything to do with heartburn, and everything comes back negative, but they still have it. So like it's not H. pylori, anything like that. So what causes it is like a bunch of different things. We're not still 100% certain on exactly what causes it, but it could be low motility. So like the intestines aren't moving. So things are starting to kind of move backwards a little bit, growing into the small intestines. It could be like a food that we eat. It could be just generally our microflora. It could be medications, antibiotics, things like that might have disrupted the microflora, causing things to have a problem in the small intestines. You can do a breath test to test for it. Basically, like you do some dietary restrictions, you take this lactulose or like a sugar, basically like a milk sugar, you drink that, and you breathe into a tube over time, and that starts to measure the production of gas, because the bacteria is going to eat that lactulose and then break that down and then produce gas. And then we can start to determine what kind of bacteria are in there. And then there's different types of gases that can be produced depending on what bacteria are in there eating the lactulose. And that can be like methane, or I can't remember the other name right now. I'll get to it. Yeah, it'll come. And then you can kind of determine what kind of bacteria are hanging out in the gut that way. And then you can do something called a weed and seed protocol. There are research papers showing that certain antibiotics can help to treat this as well. They're very specific to the type of bacteria that might be showing up on that breath test. Or you can do herbal antimicrobials, which I actually find that antibiotics work way better and are easier on the system than the antimicrobials that are herbs, because the herbal antimicrobials are non-specific. They will kill everything and anything, whereas the antibiotics will go in and kill specific bacteria. And then, so once you've killed off the bacteria, you've got to just restore the gut microflora again. So maybe you want to take a full spectrum probiotic at that time to make sure everything grows back. There's other components to it as well to make sure that it doesn't come back, because I often see that SIBO does come back over time. You probably will have to adjust your diet, which I guess is probably already hard if you're already restricting yourself so much sometimes. So you might have to play a little bit extra with that, or just anticipate that it is going to come back and get on it a little bit earlier. We also have to look at stress and make sure that the vagus nerve is moving everything appropriately through, so that we don't get backlog again. Again, just make sure your gut microflora is good, diet's clean, all those kind of things to help prevent that it doesn't come back, or help it to not come back. So,
Okay, thank you. So that is the big difference, is the fact that you could also get heartburn with it. So it's not just being bloated all the time, per se.
Yeah.
There's
and you don't always get heartburn is the crappy part. Like there's like so much overlap, but then it's not specific. Yeah.
So when do you think someone, because obviously, you know, clustering, constipation, diarrhea, those are all very symptoms of it. So how would you know when someone should get tested for that to rule stuff out? I mean, there's bloating, right? There's.
It's actually not a very expensive test. Like there's still a cost. I think we do about 150 Canadian here for that test. So it's like an okay investment to do that test sometimes.
Right. And it can help with all of these symptoms that we're talking about today. Even if we knew that we were SIBO, then we can get it dealt with, basically.
Does everybody know the meaning of that, of SIBO? Sorry, I don't know if we just sort of covered it, but is everybody familiar with that, or just want to make sure, because I actually personally was not familiar with something called SIBO.
No, we're back. I think
still from, yeah.
Was it frozen?
Sorry, I totally missed that.
Okay. No,
yeah, I know we talked about it, but if it's not clear, anyone, please definitely just tell us to go over it again for sure in the chat.
There's even some research coming out that a lot of IBS is actually SIBO. So irritable bowel syndrome. They're now doing these breath tests. They're now kind of investigating the bacteria, and they're finding that it's not just IBS, because IBS is a diagnosis of exclusion, meaning that like they can't figure out what else it might be. So it's this IBS. Now they're testing for the gut microflora stuff and seeing that a lot of IBS is SIBO.
Wow.
Thank you for clarifying that.
Yeah.
You know, those are pretty much all of my questions. There is one here. Hold on.
Yeah, it had to do with going back to probiotics, actually. Someone had asked, do you recommend them every day? And can you possibly overdo it with them?
Yeah. So probiotics are like, it's tough. You got to figure out what works for you and how you feel. Am I frozen again?
No, not for me.
Good.
Nope.
My internet might be getting tired. I don't know. But probiotics are tough. You take them, see how you feel. Yes, you should take them consistently if you're trying to treat a specific symptom to see if it's actually working or not. But if you take them and you end up getting like more diarrhea or more abdominal pain or more gas or more bloating, it's probably not going to work for you. And you should probably maybe try a different one, or just it's probably not the right choice. So yeah,
again, it kind of goes back with trial and error again to some degree, right?
Yeah. But taking consistently, take it for like 3 months and then stop taking it. Your symptoms might come back. Then you can try it again. One thing I forgot to mention before is you might want to switch up different brands sometimes so that you can get different varieties of bacteria into your gut too. So they might all have the same strains, but they still, the way they make them in the labs or the way they get them from wherever they get them from might have a slight diversity in them. So maybe if you're on the same brand for like a year, maybe try changing it up with a different brand another year, that kind of thing.
Well, that's good to know. SIBO, small intestinal bacteria overgrowth, SIBO. Now, how is that it says here in one of the questions, could SIBO mimic GERD, GERD? I'm not sure what that is.
Gastroesophageal reflux disease or heartburn, basically,
Okay.
like a type of heartburn. Yeah, for sure. So like if I used to run more of like a general practice. I don't do a whole lot of one-to-one support anymore. I do more group stuff. But when I would treat heartburn in my general practice, and we would try food changes, we would try just the typical GERD or heartburn treatment strategies, and nothing would work. Then we would go test for SIBO, and sometimes it would come back positive as well. And maybe that was their only symptom. Typically there's more going on though. Like I would say like 95% of the time you also see the gas, the bloating, that kind of thing, along with the GERD or the heartburn.
Yeah. Thank you. I noticed that Hannah just put the Mayo Clinic info too for SIBO, in case anybody wants more information. Thank you, Megan. I found this, I should say Dr. Bernard, my apologies.
Yes. Yeah, we've been calling you Megan, but
yes,
you're Dr. Bernard.
You know why? Because the name comes up as that as I see you, and it just throws me off.
No, Megan, I prefer Megan. It's totally fine.
Dr. Megan? I mean,
Dr. Megan.
Let's just do
my
that.
My mom calls me that now. She's like, hey, doctor.
I love it.
You got a doctor in the family.
That's great.
Yeah.
That's great.
Oh dear.
Yeah, this was very informative. I
Yes.
really appreciate you taking the time. I know that you have a Facebook page that has a wealth of information, especially getting your health back after cancer. And then you also have the Flourish after cancer too, right? So if anyone wants to check those out, I follow them and I find them very informative.
Yeah. Do you want to just put them in the chat, Dr. Megan?
I can bring that link up. So it's literally like if you just go into Facebook and search Getting Your Health Back After Cancer, that's my group, and lots of trainings in there on guides, just in general information about nutrition, stress, sleep, all those kind of things that just generally lead to good health, and cancer prevention. We talk cancer prevention, all that kind of stuff as well. We'll put that in here. There we go. And then I do run a group program. You'll hear all about it in my Facebook group anyway, but it's just like it's a couple-month program where I just take you step by step, learning how to eat better, how to stress less, how to improve digestion, detoxification. And it's I try to be as evidence-based as possible with like a holistic spin. So obviously not everything's been perfectly researched, and we don't have exactly clear answers, but we take what we can get and then we put that into place with what you experience, what you can handle, and see what we get from there.
Great.
Yeah. And I'll tell you the one thing that I continue to use is to make sure that I have my fat when I'm having, whether my egg and my spinach as well, and then making sure I put in a fat, my avocado. So yeah, thank you. Lots of good tips. Does anyone have any questions before we call it a night? No? Good. I hope everyone found this informative. I really appreciate you coming in. I know there was a tiny bit of mix-up on
Oops, I'm sorry. Here's my final sorry of the night. I'm sorry, Dr. Megan. I'm sorry, Connie, and all of you. But thank you for all being good sports about it. It really was a phenomenal discussion. I love this like up close and personal and intimate setting. And thank you so much, Dr. Megan, for that.
There will be the recording on the site. So
Absolutely.
If anyone had missed the beginning, please make sure you go to the YouTube channel for CCC, and you will be able to get the recording.
Correct. And if anyone's having any problems with that, just send me an email. I posted my email in the chat. I will do it once again so that you can get in touch. And we thank all of you for joining us tonight.
Yes, thank you. Have a good night.
Thank you.
Megan, good to
Thank you
meet
so much.
That was wonderful.
Thank you, guys.
Thank you so much.
Most
night.
interesting.
Good. Glad to hear. Thanks.